How you doing, everybody? I just wanted to come here and talk to you about, how important it is to learn herbal medicine, how important it is to learn how the body works and learn how to heal yourself aside from the medical institution, how it's built nowadays. Now, it has its uses. It is important and it can help in many severe situations. But when it comes to how the body works and just the natural way that we're supposed to live and take care of ourselves, people really need to come into the understanding of that. And if they want to seek help, seek actual experienced and well-versed naturalist or herbalist. Because I was helping a lady out the other day, and she was dealing with the hysterectomy, post-hysterectomy symptoms, and many medications that she was on, and also other things that she was dealing with in her body. And so she did a consultation with me, and I helped her out. And she told me that after post-hysterectomy, the doctors didn't even tell her how she had to take care of her midsection because her uterus and ovaries were removed. So that causes a number of problems. The uterus and the ovaries are so important to the female. The ovaries, they play such a huge role in hormone regulation. And the uterus itself, it literally fills up the space in the plexus of a female. So when that's gone, there's so much muscles and fascia that it's attached to that when it's removed, it's nothing but an empty space. And what that can cause is basically like that your internal structure is affected now. There's nothing there. So basically, women are more prone to prolapse. And for the fact that it's cut out, they're more prone to heart problems and bleeding problems and circulation problems because now that has been removed, which is such a vital, that's your sexual organ. That's your organ of reproduction. You need that, So when you get it removed, it causes just a plethora of problems. So I came on here to let you know, just to let people know, and especially females, if they see this video, to really think about it before they get a hysterectomy, to think if that's what they need to do. I'd say that's just a last resort if there's just nothing else left for you to do, and still consider it then. Also, she was taking many medications. They had her on 4 different medications, and what I realized is that they all stemmed from post-hysterectomy damage. So her ovaries were removed, so her hormone regulation was out of whack, and she was also dealing with gastrointestinal problems and stuff like that because first off, she was already had symptoms and problems that she was dealing with previously, and then after that, it just worsened the symptoms. Some of the medications that they had her on were, I wrote them down here, were zolpidem, which is a sedative hypnotic, and it treats insomnia. Ketorolac, which is an NSAID, non-steroidal anti-inflammatory drug, and it blocks cyclooxygenase enzymes, cyclooxygenase 1 and then cyclooxygenase 2. And what those basically do is they inhibit the prostaglandins from I'm outside, from producing in the body. So therefore, the pain is not really caused at the site of inflammation. There's no pain. She was also prescribed fluvoxamine, which is a serotonin reuptake inhibitor, or an SSRI, which is an antidepressant. And it helps, also in some cases of OCD. And then the other one she was prescribed was Rexulti, which is an SDAM, which is also serotonin and dopamine activity modulator. It's an antipsychotic, so it helps with your psychological processes. These are 4 medications that she has been put on for one situation, for one, it's basically the repercussion for having the hysterectomy. When if she didn't have that, these situations could have been helped, reversed, and maintained a whole lot easier. But now that operation has been carried out, there's certain things that she is now dependent on. Say the hormones. Her hormone regulation is now completely offset and damaged because her ovaries are removed, and those are so vital to the hormone regulation and production in females. Some of these, and also what I wanted to say as well is, when I was looking at these medications that they were giving her, when you come to these medications from the medical industry, a lot of the time they inhibit body processes to stop the, I guess you could say, painful or uncomfortable outcomes or symptoms that you're dealing with. And so with this combination of medications that she was taking, I noticed that it was adversely affecting her body and what needed to be happening. So since she had already had a hysterectomy with both ovaries removed, her hormone production and her hormone regulation is already damaged. And so with Ketorolac, some of the side effects that happens with it is gastrointestinal issues, many gastrointestinal issues, risk of heart attack because of circulation problems, kidney damage, and liver performance failure. With fluvoxamine, which was the antidepressant, is also gastrointestinal issues, neurological issues like sleep deprivation, weakness, and dizziness. And since she's taking zolpidem, which is a hypnotic sedative which treats insomnia, she's taking fluvoxamine, which also inhibits and disrupts the neurological processes like sleep, weakness, and dizziness, and the wake and sleep state, which also involves the anabolic and catabolic processes, which regulate your ability to make energy and store energy, also your sleep patterns, your circadian rhythms. She was taking Rexulti, which is also, it says it puts old people at risk of increased chances of death from heart problems and infection. So those are just a few of the symptoms that she's dealing with, or side effects that come with these medications that she was prescribed. She's dealing with post-hysterectomy issues, also previous situations and issues that she was dealing with. And her hormones should be one of the main things that you focus on balancing. Also, sleep is what you should be focused on balancing, and of course, neurological issues. So what she was also dealing with before was liver problems and gallbladder problems. So you're taking medications that damage the processes of the kidneys and the liver when you were already dealing with that before. So when you're having problems with those organs, a lot of the time, like if you're dealing with stagnation or if you're dealing with deficiency, some of the symptoms are depression, because your hormones, just because of that situation, your hormones are already out of balance. And so now you're already dealing with problems with depression and other emotional imbalances. And so you're also taking sedative hypnotics, and you're also taking serotonin reuptake inhibitors. Also taking dopamine, basically like dopamine inhibitors as well. So you're messing with, first off, your hormones are already out of whack. Your hormones are already not functioning and not being produced correctly. And now you're taking medications that are prescribed to you by your doctor that further inhibit the production of the correct hormones and also body regulation systems. So what I told her, I told her that she could take valerian root, that she can take chamomile, that she could take different herbs for her sleep and take them at night. I also told her that when it comes to her stagnation and it comes to her liver and gallbladder problems, that she can use, or she can eat certain foods that help move the system along and also drain out the wetness and the moisture inside of her system. She's been doing that, and I also prescribed her a tea, or gave her a tea, and it's been helping her more than she said that any of these medications have. This is just an example of how natural medicine, or just I say original medicine, is key for everybody. It's key. You need to learn this stuff. And if you're going to the medical industry, it has its place. It's just go for something that is like just dire. You broke something, or you need to get a look inside of your body because they have the technology to look inside of your body. Go for these things, and when you find out what is going wrong with yourself, then try to take a more natural approach and see a professional for this. I feel like I wanted to put this out because most women, a lot of women, it's crazy how many women have hysterectomies yearly. And a lot of women are on the fence thinking about, should I get it, should I not? I'm having issues, but should I get it or should I not? Personally, I think you should not. That is like a last resort, if a option at all. And if women are watching this, I just hope that, you walk away with something and just think that some post-hysterectomy symptoms are early menopause, hormonal damage, infection, prolapse, risk of heart performance damage like coronary heart disease, sexual dysfunction, and blood clots. Hormone damage. Hormones are the triggers for every body process that you have. So, I hope you walk away with the fact that if you are thinking about getting this operation, think twice. Look for a more natural approach. Seek a professional herbalist, naturalist, before you go and say that you want to get this operation done, because it changes your whole life. Also, I want people to walk away with that natural medicine, or they say alternative medicine or herbal medicine, is original medicine. This is what we had before we had the age of industry that we have, and before the Rockefellers and all these other elitist families, because I don't call them elite, but these families with power and influence have came and changed the whole way that we do medicine, and came to change the whole way that we look at medicine and care, body care. It comes from the earth, just like we come from the earth. So, with that being said, I hope y'all guys walk away with some more information. If there's females that are thinking about getting this operation, think twice. Look towards more natural ways to go about it, and just think about the fact that it's already confirmed that these medications that we get and that were prescribed from the current medical institutions nowadays are just as dangerous as they claim to be beneficial, if not more dangerous. And so when you look towards the natural route, like herb combinations, diet, combinations of herbs and diet and lifestyle, they have way less complications. Most of the time, they only have benefits. With the sacrifice of you're going to have to dedicate 2 weeks, a month, 6 months to a year of a lifestyle change. And then hopefully you carry it on from there, because that's the way you're supposed to be living already, So, y'all have a good one.